Dr. Michael Snyder, runs the Snyder Lab at Stanford University. I got an Oura Ring on. I've got a smartwatch on. Some of you guys have continuous glucose monitors. Well, that technology came out of the Snyder Lab. In episode 19, we reflected on the potential that a smartwatch, a simple smartwatch combined with genomics, to maybe become our primary care providers of the future to truly improve our healthcare.
Now, in the case of smartwatches, I'm quite confident they can tell you when you're getting ill, but they do set off other red alert system I was talking about. Actually, other things trigger it. Turns out number one trigger is workplace stress.
Yeah.
So it's also a mental health detector. But this is where we need more data, because I'm quite confident we can tell the difference between a respiratory viral illness and when you're mentally stressed. Just your breathing's going to be different. So with more data, I'm sure we'll distinguish that. But even still, I would argue just knowing when you get these red alerts, if you're just sitting around not doing much. Now, if you run a marathon, by the way, your heart rate will stay up for several days. That triggers red alerts. That one's easy to contextualize. But if you're just sitting around being your normal self and you get a red alert, you're either mentally or physically stressed. And you should look into that. If it's physically, you might get a COVID test, for example, and see, oh yes, I'm positive. Maybe I shouldn't go to that party tonight. Stay home and not infect everyone. When you catch disease late, it's very hard to cure and fix. Cancer is like the perfect example. Once it's metastasized, very, very hard to cure, meaning when your cancer is spread. But if you can catch it early, you can usually treat it and in many cases cure folks. And I think that's the name of the game. We want to keep people healthy. We want to catch disease when it first appears so we can, fix it. And again, keep people healthy.